Hello, everyone, and welcome back to Voices in Health and Wellness. I'm your host, Dr. Andrew Greenland, and on this podcast, we sit down with practitioners, clinic owners, and health leaders who are doing the real work. And today's guest brings a unique perspective on one of the most overlooked issues in private practice, billing. Dr. Christian Robertosi is a physical therapist and orthopedic specialist who's seen the system from the inside. He's also the co-founder of Total Care PT Billing, a company that helps clinics streamline their revenue cycles and finally get some clarity on what's coming in and what's leaking out. Christian, thank you very much for being on the podcast today.
A relationship with Prompt, and Prompt started sending us referrals. And so what we've seen in the last 2.5 years of having this billing company is that a lot of these clinicians are very much like me, at least on the front end, is they really don't know what's going on in their clinics. And so we're going about taking, we see two different types of clinics. We see the new clinician. So they're starting from scratch, and that's easy. There's nothing that we need to track down. But the bigger headaches and issues out there that maybe we can talk a little bit more about is we have these clinics that are established. They're seeing a fairly high amount of patient streamlining in, patients coming into their clinics. So they figure since the money's coming in, everything's good. And then usually once their previous biller starts to taper off in the effort, they see revenue drop down, then they start to get upset. And so what we see is people complain about reimbursement with insurance. But my experience has shown me that the reimbursement, for the most part, there are a few exceptions out there in the country, a couple of states that notoriously reimburse lower. The revenue is there. It's just good billing is not. And because the clinician is just running around trying to see these patients and keep his or her head above water, just seeing these patients, getting the documentation done and submitting the claim to us so that they can get paid. They really don't know what's going on behind the scenes. And so they assume that when their revenue starts to taper off, it's because insurance is reimbursing them poorly. And really it boils down to they're not paying attention to the claims that are not being paid, rejections for whatever reason. And they're not staying on top of their staff. And so because they're just assuming that everybody else is doing their job like they are, that everything it is the insurance company's fault. And really it more times than not seems to be internally. If they can get their systems in place, their revenue goes back up and they're doing better. So that's kind of what we're doing in a nutshell, and where we see some of the problems with clinics right now.
Got it. So the genesis of this business was really out of perhaps a sense of frustration, or the fact that there's a big hole in the whole industry in terms of how this process works, from the billing aspects through to the reimbursement, although you say the reimbursement is not the problem, it's everything else. But you've really driven to do this by virtue of the problems you were having in your business. Is that a fair thing to say?
Yeah, I mean, I've seen it several times with the clinics that we do take over. We're not business people by trade, and so we really don't know what's going on. You just kind of fumble through it. And then, I think I just took understanding the revenue cycle a little bit more seriously than most other people do. It's a headache. It's hard, right? Like I have my staff chasing down pre-authorizations, trying to get more visits for people, just figuring out what the actual, like insurance benefits aren't necessarily listed correctly in these portals. And so then that leads the insurance verification specialist, to make a phone call. It's a lot of work just so that you can get paid, once you do your job. And so I can see why people would be hands off. It's very complicated. And it's tough to understand. And then finding the people that actually can do it, they're out there. They're absolutely out there, but it takes knowing a little bit about that to vet these people before you hire them. And that's also tough and time consuming.
Yeah. So what does your day-to-day look like now? I mean, are you still involved in patient care, or are you fully focused on the billing operations side of things?
Yes, I have my own clinic.
Mhm.
It's been operational now for 8 years.
Hmm.
Um, but then we started Total Care, and so we about 2.5 years ago. And so the clinic is a job for me. I'm very much in it, working in it, seeing patients Monday, Wednesday, Thursday, and Friday. Um, on Tuesdays, I kind of dip back into the Total Care side and make sure that everything's going well, and working with the staff and seeing what needs to improve or whatever. But yeah, I'm in both, but the Total Care is more of a business for me. Sarah is my chief billing
Hmm.
officer. She's been with us for the last 2.5 years, and she's a superstar. She understands the revenue cycle from start to finish. She understands CPT codes. She understands HIPAA compliance and all that good stuff. So she's the one really leading the rest of the team. And then we have a really great team of billers as well as insurance verification specialists. And so, yeah, I'm in both, and enjoy it. We've been able to help a bunch of clinics go from like being on death's doorstep to like doubling their revenue, and they can keep their doors open and continue to grow and flourish. And so that's the part that I enjoy. I was never quite that far along in terms of having my revenue dry up, but I've felt that pain, and I'm sure if any other clinician is listening to this right now, whether they know it or not, with probably a few exceptions out there, they've gone through that pain of not having money come in like it should. And they work hard, they deserve it. They need to pay their staff, so they're dealing with the stress of making sure that everybody is paid. So I take a lot of pleasure in knowing that that's one less thing to worry about. It really shouldn't be on their plate to begin with, but it comes to their attention once it gets bad enough. So we like to help out.
Got it. So I mean, are you servicing other clinics in this niche, or you extended it to the wider sort of health and wellness industry?
We're pretty specialized.
Hmm.
So I'm a physical therapist by trade,
Hmm.
and so I understand that coding. I have a relationship with an EMR company, Prompt, which is a really killer platform. It's billing. The billing portion of that platform is incredibly strong, and so I liked it as a clinician. It allowed me to see everything. So once my business partner was like, "Hey, we should go and do this ourselves," um, we just reached out to them and
Hmm.
said, "Do you do referrals?" I'm like, "Yeah, sure." So that was kind of how it was born.
Got it. I mean, I've done a number of these interviews, these podcasts, and I have to say that everyone I've spoken to in a US health and wellness space, insurance is the one thing that seems to be the universal bugbear in terms of the things that are bottlenecks for their business. And obviously, I'm very interested to hear that you work in this niche. I just wonder what the market is like for other niches in the health and wellness space. Are there other people doing this, and to what extent, and kind of how do you fit into that picture? Because it seems like there's a massive demand for this kind of thing, and from what you said about what you're able to achieve for people, it sounds pretty amazing.
There is a demand. So
Mm.
here's let me tell you at least how physical therapists work, right? Like
Mm.
our profits margins, even though there is money to be made, are a lot slimmer than a private practice physician or an orthopedic surgeon or a neurologist, right? Their revenue is much, much higher. So ours is thinner. And so that makes the clinic owners very sensitive to cost. And so they're not looking at me as a money generator. I'm just another bill on their docket. And so my competition, there's billing all over the place. And what's happening a lot is a lot of that billing is being sourced overseas, and the people that are doing that, um, they're in different time zones. They might not understand the revenue cycle here as much. There's lots of limitations I think that they encounter. And so they're doing it for super cheap, but they're doing a poor job. And I've taken over a couple of clinics that had outsourced it to that, but they're only charging, a very, very small amount because that billing company can do that because they're paying their staff next to nothing. We charge an uh, I think an honest rate. It's definitely enough to pay good billers to do a good job. And what we've done in the past is we've had clinics where we've doubled their monthly revenue, or at least increased it substantially, even though their patient care is about the same. So yes, there's a really big need for good billing. Some people want to have billers in house because they want to be able to have that conversation in real time. Um, and once a clinic gets big enough, it can be feasible to do that. It becomes more feasible to do that. Um, some people, for whatever reason, maybe they're not big enough, and so it would be really expensive to have somebody full time. And so having a fractional biller, kind of like us, makes more sense financially. But a good biller will make you money. They should not, and it's taken me years to see this and understand it. There's a lot of need for it, and somebody that really knows what they're doing will make you money. They'll fight for the work that you've already put in and get you paid, and they're relentless. A bad biller is going to quietly, here's an example of where you see problems. A bad biller, instead of telling you, hey, I'm getting these denials, I need you to do a peer-to-peer with this insurance company, they're just going to quietly write it off. And your AR looks great, right? Because that was closed out, and so things look like they're moving smoothly. That person is probably this example here is probably just writing stuff off left and right, and the clinician doesn't know it until they start to see their revenue drop, and that's when the questions start to get asked.
Got it. So based on some of the things you've mentioned about you've been able to double the income by virtue of the service you provide. So do you think most clinic owners actually know what their true billing picture looks like?
No. And even, it's interesting too, because we will do audits of people's billing practices. PT is pretty straightforward. I think getting into positions, they have way more codes and it gets more complicated, but we're pretty straightforward. And we'll just bring up differences in billing for their time, right? PTs are very much time-based CPT codes. You need to spend time with people. So with Medicare guidelines, CMS guidelines, you can bill up to, in most cases, 4 units for the hour. AMA guidelines, you can get 5 units. And so when we bring that to the attention of a clinic owner, hey, your staff are historically billing out 3 units in an hour for this Medicare patient, and maybe only 4 units for some of these commercial insurances where it could be 5. If you just add that extra unit, you could be bringing in X number of more dollars. Some people are very receptive to it. Some people think that we're trying to trick them into doing something fraudulently, which of course we're not. It's interesting. There can be resistance to that too. So the owner needs to educate themselves. There needs to be a little bit of work on their end to understand what they're doing. We can only guide them, right? We can't put those units in, certainly if the work hasn't been done.
Interesting. So what do you say are some of the simple and powerful things that clinics could perhaps do to get a clearer financial picture based on your experience with working with these various clinics that you have done?
A clearer picture, really, you need to carve the problem is, and I'm guilty of this too, right? Like once your day starts, you're just seeing patients all day. Carving time out to sit down with your biller or billers, depending on how big it is, and taking that time and having them show things and explain things to you would be a game changer for probably most clinics out there. And you don't necessarily even need to understand the intricacies of billing, but if you pull up your chart of people that you saw last month, right, and then you pull that same chart up again this month, and then you start to go line by line of payments, and you see there's a couple blanks in there, that's a great place to start. You don't have to understand anything else outside of like, there's not a dollar sign next to these people's names. Why don't you explain that to me? Why didn't we get paid on these people? That's scary, right? Like you're not making money necessarily by spending that time with your staff. And so that feels like a waste of time. But I will tell you, that would be a huge game changer for any clinician. Just taking, I'm sure it depends on the clinic size, but like taking 30 to 60 minutes, man, a month, once a month, maybe once a week, depending on the size of the clinic, and just staying on top of your billing, your biller, would be a huge shift in positive revenue for you guys, because now they know you're watching, and they're going to start asking you're going to start asking questions to your biller on why we're not getting paid on this person. It's been 3 months. It should have been paid by now. They're going to work a little harder.
Absolutely. So delving into the weeds a little bit, are there any numbers or metrics that you think every clinic should be tracking that you've found that most aren't doing?
Yeah, like the easiest part is just looking at your AR, right? There's a couple different things that we look at with our clinics that we talk about weekly. So what is your 0 to 30 AR, day AR? So how quickly are you getting paid on the claims that you submitted within the first 30 days? Some clinics can be a little bit different. My business partner owns a DME company. He's happy if he gets paid in the first 90 days. His timeline is much longer. So you need to understand your timeline. We have some clinics that do a lot of workers' comp, and that historically takes longer. So 0 to 30 isn't always appropriate, depending on the type of clinic you are. But most of us take commercial insurance, and it pays in a reasonable amount of time, 30 days, 45 days. So that number should be pretty good. It should be pretty high. We shoot for 80 to 90%. So seeing that number is a great first pass test to see the health of your income. The other is understanding the CPT codes that you're putting out. Like our EMR can print the average reimbursement per CPT code. And that can be really powerful, right? Like you might be billing something out that never gets paid, and your biller just never talks to you because you never talk to them. So there's no reason for them to have that conversation with you. They're doing their job and you're doing yours, but you've been billing out this code for years and don't know that that code doesn't pay or doesn't pay well, and that there's actually another option out there. So once those questions start to be had between you and your biller, you start to understand how insurance is paying you, and that can help shape the way you're coding, and that also boosts revenue as well. So having those two things, looking at your AR reports on a regular basis, and then CPT reimbursement, that's not necessarily so much of a weekly thing. That's a pretty standard. That doesn't change too much. But seeing if that you're getting a lot of denials in certain areas or for certain CPT codes, that's interesting information too, right? Now you can recode that particular service to something else that does reimburse, and now your revenue goes up. So those are the 2 or 3 that I would look at.
Brilliant. I'm guessing what you do is very much a sort of done for you solution from the way you're talking, but how do you stop the clinics getting overwhelmed with tech and spreadsheets when you start working with them?
We're having a conversation like this, and we'll point out something super easy. Hey, they're already, usually when we get them, they're already overwhelmed. Because now this clinic owner has been trying to manage the billing in the background while they've been looking for somebody like us. So we're really high on service. Usually clinics start to see that something bad is happening because the communication breaks down, right? That's like a universal human truth, right? Like if you could be the best physician in the world and a terrible communicator, they won't like you. Not very much, unless you're like really amazing. But the clinician that does a great job showing empathy and listening, right? Everybody loves that person. It's no different with your biller, right? Like that person, when you ask them a question, they need to respond. And so that's something that we're really high on with our billing staff is that, you're answering those text messages, those emails, those phone calls. So just by the clinician seeing that when they have a question, we answer it, and it's really it's a legitimate answer because we're really doing it, that lowers the stress. And then we're taking care of all the billing on the background. So there's usually a little bit of trust that needs to be built in the first couple of weeks for them to
Mhm.
really understand that we're different and we really are doing our job. And then they're happy to set it and forget it, leave us alone and let us do our job. They do theirs. Um, but again, whether it's me or anybody else, right? Like you really need to know that your staff is doing a good job. They might love you and they might be really doing their best, but that might not necessarily be the best work that can be done. And that's where you need to manage it.
Brilliant. So it sounds like you've found lots of solutions and you're helping lots of people, but are there any bottlenecks still left that you've got left to solve? Have you got something you'd like to wave a magic wand over to fix in the billing landscape for the clinics that you work with?
Yeah, I mean, we've kept our hands away from doing credentialing. It's painfully slow. And you're usually having your contract sent back to you because you missed, one dot here or there, or forgot to cross a T. Um, we've done it like once or twice, and we end up being the bad guys because it takes so long. And
Mhm.
it's not really our fault.
Mm,
It's a gruelingly slow process, and so
mm,
we've kind of walked away from it because that's like a nobody wins scenario. I have a really great lady that does it. She's in Massachusetts, Michelle. um that would be one. But I don't want to necessarily tackle that. What are the boogeymen out there? Um, a lot of times it's a lot of times, like we've dealt with lots of companies across the country, so we've seen a lot. So we have a really good understanding of how billing works. And sometimes people are just they've been in the game too long, or they think they know more than we do, and so they're not willing to change, and they really hurt themselves more than not. So maybe I need to do a better job of communicating. I don't know. That's what I can see is it's a relationship. We're trying to have a relationship with them,
mm.
um, s- in their best interest. Like I legitimately want to see these clinics thrive. I know they're working hard. I do the work myself, and so I just want to see them win. And sometimes they won't allow themselves to be successful.
Mhm. Interesting. So where do you think this industry is headed in the next year or two, and where specifically do you want to be in the next year or two with your operation?
The billing industry,
Mm,
it's interesting. I heard a statistic the other day that in the US, the biggest group of healthcare professionals are therapists. And so I am you're seeing a couple different things. There are private equity firms that understand this, and they're starting to snatch up these mom and pop clinics and kind of grow their team of billers because there's just so much billing going on for us, or us being the healthcare professionals, physical therapists, occupational therapists, those guys. Um, will it turn into a bunch of really big billers? I don't think so. I think it's tough for them to do a good job. I'm small, so I know all of my clinic owners by name. They email me when they have a problem. I solve it. Um, can that be done on a large scale? I mean, Amazon's done it, so it's certainly possible. I haven't seen a big one out there that's doing it that well. Where do I want to be in the next year?
mm,
We're just trying to grow, and I enjoy the process. I like, when we get a new clinic, it's a new clinician, maybe not a new clinician, but a new business owner. And he or she really doesn't know what they're doing. And I've been through those pains. And so I enjoy sitting down with those guys and just kind of talking them through what their next steps should be. And that feels good too. I remember when I was in their shoes just wanting some help. And everybody, it seemed, that had advice to give wanted $200 an hour, which I didn't have. So I'm
mhm.
happy to hand out some free advice. I guess you get what you pay for, but I've done it. So I think my advice is pretty sound. So, I mean, just hopefully just keep on doing this in the next year, hoping to continue to grow our company. We've got a great staff. We enjoy each other. We've got great clients. We enjoy working with them and seeing them thrive. So, I mean, to do more of this is fun. Maybe I could take myself out of the clinic a little bit more, maybe only treat 3 days, do more billing stuff 2 days. That would be cool.
I mean, it sounds like you're doing a pretty amazing service for delivering a much needed service for people in this industry. Is there any barriers to growth from your point of view? It sounds like must be a huge demand for what you do, but is there anything that's stopping you from growing to the level that you'd like to?
Yes, and some of that's intentional. So we've had, you'll see some billing companies out there that they'll take anybody. And so that means that their billers are billing in numerous platforms. And I think that's a disservice to the clinics that they serve because these billers aren't becoming ultra aware of how to use each platform. So they're mediocre in each one. And I've seen that from the clients that we've taken over where they had these types of billers. So we've specialized not only in just physical therapy billing, but just in prompt. Our billers know that like the back of their hand. So we've had so many meetings about this, but we are willing to only bill in prompt so that we are excellent at billing in prompt and get the results that we expect out of ourselves. The flip side of that is we're not taking referrals for people that are in other software because we don't want to learn it. We're not going to be good at it. We don't want to be good at it. We want to be good at working in prompt. So that's our limitation, I guess. If there was a sea of prompt users that needed help, call me. I'd be happy to assist you. But otherwise, we're kind of left to get referrals from the tender mercies of my friends at Prompt, and they've been really generous. But that's what kind of that's the direct flow of referrals that we get, how we get them.
Prompt is what? Sorry, excuse my ignorance. What is prompt exactly?
Oh, it's fine. There's a million. It's an EMR out there. It's
Okay.
specifically designed for physical therapists and other types of allied healthcare. Like I know they chiros use it a lot. Occupational therapists use it a lot. So it's those. There's some one-offs of different types of healthcare professionals that'll use it, but it's really built and designed for those types of clinicians, therapists, chiropractors.
Brilliant. And would you say what kind of clinic owners are best positioned to thrive in the new environment, or where billing is going in the future?
Somebody that's willing to take ownership of their clinic. That might seem silly. Well, it's my clinic. Of course, I'm going to take ownership of it. But I will tell you that even though there are a lot of clinic owners out there, I feel like they've kind of washed their hands of everything once they open the doors and they expect everybody else to do it. And there might be clinics out there that do just fine with that. My experience has shown me that the clinic owners that are involved in a positive way and take ownership for the clinic's outcomes are the guys and gals that do the best. Somebody that thinks that everybody else should do it for them is in for a really rough time. You just need to be out there hustling, right? Like you need to be the face of the clinic. You need to have a good rapport with your staff. You need to make sure that you're having those touch points with your staff. They like you, they like working there. If they don't, why? That's your job to solve it. You need to be out there making sure that your relationships are strong with your referral sources, the physicians that are supporting your clinic, making sure that they're happy with you. It's hard. I mean, it is much harder than being a staff clinician anywhere. But it's very doable and it's very rewarding. It's exciting. I think it's way better than just working for somebody. So you just need to be willing to put in the work. That's outside of work ethic, I think anybody can get it done. You just need to know that that's the life you're signing up for, and it's a lot different than just punching the card and being a 9 to 5 employee.
Christian, thank you so much for your time this afternoon. It's been a really thoughtful and eye-opening conversation, and you've been really generous with your insights. I think there's lots of actionable information that people listening to this will find helpful. So thank you for your time. Really appreciate it, and wish you a very good afternoon.
Thank you so much.